pardon me, which is a presentation by the Sheriff's Department. Sheriff Wickersham.
Good afternoon, Commissioners. I was asked to appear here today to kind of do a presentation and overview of the Sheriff's Office, especially for the new Commissioners that are on the board. Also was requested to talk a little bit about inmate health care. So I'll go along in my presentation. I'll provide you some statistical data, and then I'll field any questions if you guys have any. So, Macomb County Sheriff's Office, kind of an overview. We have several components. We have a law enforcement component. We have a jail component. We do the courts. We have 524 budgeted positions. On the law enforcement side, we are the contracted police agencies for 6 communities, Macomb Township, Harrison, Mount Clemens, Washington, Lenox, and New Haven. We have a couple deputy sheriffs per shift working the 4 townships in the northern end of the county, Ray, Bruce, Armada, and Richmond. We have a traffic bureau that's funded both with general funded deputies and grant funded 416 from the state of Michigan. We have an evidence technician unit, that's crime scene, that processes all of our evidence, our crime scenes, and traffic crashes of serious nature and fatalities. We have deputies assigned to a SWAT team, Special Weapons and Tactics. That's a multi-jurisdictional team. We have members of Utica, Fraser, Chesterfield, and Sheriff's Office. We also have 2 doctors from Henry Ford that are on the team, and MedStar Ambulance, so our team is well equipped. We have deputies we have our own drug team. I also have a deputy assigned to County and Macomb Enforcement Team and the DEA in Detroit. We have an auto theft team that's funded by the Auto Theft Prevention Authority, and again, that's multi-jurisdictional. I think we have almost every law enforcement agency in Macomb County that's represented there. This year, I had a fugitive team over the last few years, and we cut back and had to reassign one position, and we took an opportunity to partner with the United States Marshals. So now we are working with the United States Marshals. My team have partnered, and we're actually housing them here in Clinton Township. So that's working out real well. We're handling fugitives here in Macomb County for all agencies and getting bad guys and gals off the street. We have a Marine Division that you're well aware of, Computer Crimes Task Force, Major Crimes Task Force, and a K-9 unit. Our investigators both handle things from the adult side and the youth side. We have a reserve component. We have several units, Marine Safety Officers, ATV, bicycles, Aviation, Horse Mounted Division. We have 250 reserves. So when you look at it, the reserve force is just as large as most police departments here in Macomb County. Our dispatch center, ComTech, if you heard that term, we do all the police, fire, EMS for the 6 contracted communities in the northern part. We've entered over the last 3 years with Clinton Township and Sterling Heights to do their police, fire, and EMS. I know our staff has been here in front. We're going to be doing fire dispatching for Harrison Township and Washington Township in the near future. In our dispatch center alone, we have a administrator. I have 4 supervisors and 56 dispatchers. When you look at the population, we're dispatching probably about 460,000 if you combined all of those communities. That's just a little over half of the population here in Macomb County. On the court side, we transport 20,000 prisoners a year to different courts, hospital, and doctor visits. Currently, we have 14 deputies that are assigned. We double them up, so that's 7 vans. But at peak times, and I know at my budget presentation last year, peak times we have to run anywhere between 10 to 14 units to get those prisoners to court on time for the judges here in Macomb County. All of the circuit courts have deputy sheriffs in them. We have rovers that work in the building. We have a deputy assigned to the Romeo Court on a full-time basis, And the new Baltimore court, we do backfill when Judge Hackle's court officer is off. You have your protective service officers, commonly referred to as the blue coats here. We're responsible for managing, staffing, all of those individuals and the hiring practices. We have a civil division that we contract out. Our current contract is with Civil Staffing Resources. They handle all the sheriff sales, process services and such, things of that nature. Now the jail. A little history on the jail. The original jail was built in 1954. We added another section in 1968. It's a maximum security section. 1978, we added another section. It's called the rehabilitation. In 1987, we opened the tower, which everybody sees from Groesbeck Highway. And in 1999, we opened up a 200-bed annex, dormitory-style minimum security facility that handled the minimum security inmates and work release program. Currently, our rated design capacity is 1,238 inmates. We have 200 beds offline that we took off in 2009 when we closed the annex and lost 12 corrections positions to save money. So if we were able to get the other 200 beds opened back up, we'd have 1,438 beds available. If you didn't know, the judges here in Macomb County, both at the circuit court and district court level, are on a bed allocation plan. Each judge is allotted X amount of beds, and they kind of manage their population and help us control the overcrowding issues there at the jail. Last year, prisoners that came in, we booked almost 20,000 that came in on a daily basis, or on a year, but in a daily basis coming 20,000 books. We have Continental Canteen is our food service provider. They also do commissary services for us. I think our meal is just over $1 a meal. That's breakfast for breakfast, lunch, and dinner. We do get a revenue from them from the sale of commissary items. Last year we brought in about $452,000 that goes into the general fund to help out on other county, projects. IC Solutions is our telephone vendor. They also provide us video visitation. There's a revenue source there, $915,000 that we got last year in revenue. And again, that goes into the general fund to help out other departments. In the facility, we have Lance Cruz Adult Education that provides educational and get a GED while they're incarcerated. We have substance abuse counseling through Clinton Counseling. We have a community corrections bureau that's there that helps us reduce jail beds and place individuals that are incarcerated into facilities and treatment centers and try and help us reduce our population. And the health care. Our health care provider is Correct Care Solutions. A little history on Correct Care Solutions. When we went out to bid in 2011, they were awarded a contract. It was for 3 years with two 12-month extensions. We renewed in 13 to 14, and we renewed in 14 to 15. The bid went back out at the end of 15, and there was only one healthcare provider that bid on the contract. That was Correct Care Solutions. They were awarded the bid, and they are our current healthcare provider from January of 2016 through December of 2018. Total cost for this 3-year contract is $5.1 million. For 2016, which already passed. 2017 is $5.3 million, and in 18 it's 5.4. It's a 3% increase per year. Just by way of statistical information, reference Correct Care Solutions and the activities inside the jail. For 2016, we were averaging 34 ER visits per month. We're taking inmates. Hospital admissions were 15 inmates per month were admitted to a hospital. Mental health intakes, that where we've assessed mentally individuals that may have some mental health issues, 374. Nurses contact in 2016, 7,185 nurses contacts with the inmates in the jail. X-rays, EKGs, rounds that they do, vital signs, checks, dialysis, restraint chair checks, if we've got to put somebody in a restraint chair, is well over 5,000. So the healthcare, it's a lot going on in that jail. You got a lot of individuals that are substance abuse dependent, and they get sent to jail, and we have to take care of them. One statistic I think is really shows you where we're at with the opiate abuse, opiate use, is that in 2014, they gave out Librium, which is a detox protocol medicine that they give to the inmates. 2014, they were giving out 660 doses. In 2016, we're up to 1,600 doses. So you've got a facility that's individuals that are coming in are opiate dependent, and while they're there, they're going to go through withdrawals, and the medical staff's got to monitor them and keep an eye on them and send them out. So, healthcare, it's one of the largest contracts that we have, and again, they're very busy. Finally, now you could find this, our budget for 2017, $68 million, $19 million of that is in revenue. And then some of the challenges that we're facing currently, and that we're looking at coming up with some solutions, is the jail and the housing. We have the feasibility study that is completed. I have every intention, I've sent my letter through the proper channels to be placed on your May 11th agenda here, where we have the consultant that did the study coming in to do the presentation to this board. And we have some ideas and some solutions, and we're going to be looking forward to move forward with that. Staffing, you hear in law enforcement, it's hard to get individuals that want to continue in law enforcement or want to be part of law enforcement. We're seeing that at the sheriff's office also. For the new commissioners, we have two avenues to get into the sheriff's office. One is corrections, and one is dispatchers. And from there, we promote to deputy sheriff. So there are a lot of law enforcement jobs out there, and again, I don't want to get into the financial aspect, but most of the law enforcement agencies, at least in Macomb County, are paying a little better than what we are here at the county. So some of these individuals, when they're looking at where they want to go work, they have a lot of options, and they're going, and you can't blame them, they're going where the money's at. We see some increase in our transportation costs. I asked for additional funding through the budget last year. I was given a little bit, but with where we're at with our turnover, we have a lot of individuals that are retiring. The training process and the overtime, and again, the transport of inmates, the inmates at the hospital. I mean, on a good day, we may have 2 inmates that are at a local hospital. On our bad days, we've had 8 or 9 that are in hospitals that have to have an individual deputy sheriff guarding them. And that's all on overtime, and that's kind of putting my budget out of whack there. And that would be my presentation. So with that, I will entertain any questions.
Thank you, Madam Chair. Hi, Tony. Thanks for coming. Looking forward to hearing the jail study presentation next month.
Yes.
I think everybody is. I just had a couple questions. When you were talking about the SWAT was countywide, does Warren have a SWAT team too? Or?
Yeah, Warren has their own SWAT team. Sterling Heights runs their own team. Some of the smaller St. Clair Shores, Roseville, East Point is actually with us now.
But is it available to anybody, though?
Yeah,
I mean,
we'll-
if you needed
Yep, if needed.
two in
we'll-
Warren and they were already busy, you'd still go down and
We
cover
would go
them?
down there, exactly. Yep.
Is there a cost allocated to that service if you actually call them out into your community, or
No.
is it? Okay.
No, again, we've utilized the team, and thankfully, we don't get called out that much.
Right.
But when the time comes that they need them, this is a well-trained team. They're the only team, I think, in the region that's a level 2 CBRN type team where they can put on the gas masks and the respirators and go and take care of a situation.
Got it. And you were talking about a bunch of the different crime units, and I don't. Do you have an elder crime unit? Do you guys like break that off into something separate also, or?
Not really. Our detectives will handle those cases as they come in from the different communities. But one of the biggest things that are going towards the elderly is the
Phone scams and.
well, it's the home scans, but it's transient individuals that are coming and taking advantage of our elderly. Again, they have the extra materials, the blacktops, and we'll take care of you, and you do it for $300, and then once it's complete, it's a $3,000 bill. They're feeling a little intimidated. There's an expert out of Warren, the new commissioner, Matt Nichols, that's doing some seminars on that, and we're looking at refocusing my major crimes team to handle some of those this spring.
Great. Okay, thank you.
Commissioner Carabelli.
Thank you, Madam Chair. Thank you, sir. Question for you. Your meals for the prisoners at a cost of $1 a piece, plus or minus. Do you do the JJC as well?
We do not, no.
So it's not together, they have a separate contract for that?
Correct.
And the company you said again was which?
Continental Canteen.
Thank you very much. Thank you.
Commissioner Drollet.
Thank you, Madam Chair. This may be treading on your actual report that you're giving in May, but last time as a commissioner in a former life, there's a lot of concern about jail space. Is that the report that you'll be giving in May related to availability of jail space and that sort of thing?
Without tipping the hand, most of it's going to be where we're at, some of the programs that we're doing, some of the programs we could do if the courts and the judges are on board with some alternatives to incarceration. But part of that study is where we're going to be in 25 years, what our projected bed space might need, and then it's also an in-depth of our current infrastructure and some of the pitfalls with that and what we need to do to correct it.
So it sounds like a pretty broad study of future needs. Has there been any current overcrowding concerns in the last couple of years?
2016, we did not have to declare an emergency. 15, 14, and 13, we did.
Okay, so they have been. So,
Yep.
okay.
And again, majority of this is right now is being controlled by the judges. They're looking at their bed allocation and kind of managing it. And again, that was put in place, I think it was 2005 or 2006.
I'm not familiar with how the procedures, but how do the judges manage that sort of thing?
They would take a look at every day. They get an update of how many individuals that they have in jail.
Okay.
And, I use the thing is if they get 100 beds and they're at 100, they may have to look at making some moves to maybe let somebody out early. It's totally up to the judge.
Okay.
Or maybe if their other judge in the neighboring community isn't at the level, they'll negotiate.
Is there a way of sort of characterizing the number of people that have to be sort of, let out early in some capacity to manage that?
Right now it's really being managed. We haven't had to do that, but I'll give you an example that in 2015 when we had to release, I forget what the percentage, it was a low percentage of individuals that had a time cut. And the first day about 70 some inmates went out the door on that time cut, but the time cut affected about 400 inmates.
I see. And at the risk of pandering, I just want to thank you for the job you're doing in Macomb Township, which is amazingly efficient and professional. We're very lucky to have the Sheriff's Department as our law enforcement provider, so thank you.
Men and women are great that work there.
Thanks, Madam Chair. Good to see you, Sheriff.
Thank you.
I will pander for a moment. I've been an attorney for private practice for 20 years, so you know, and I've dealt with different departments, not only in Macomb County, but in other counties as well as on the federal level. And I will say this, and I think I even said this in my press release to the Detroit News and the Free Press and the Macomb Daily. By far, I find that the Macomb County Sheriffs are the most professional group of individuals I've ever dealt with in any type of case I've had involving them. And I think that comes from the top down. I can usually tell when a department's not happy because the people on the bottom aren't happy, and those are usually the people I deal with, and I've always had good results with the Sheriff's Department. But I do have a question that deals with the heroin problem.
Yes.
As your statistics revealed, I mean, we've almost tripled the amount of usage of a particular drug you have at the department. What's going on the enforcement end? I know you've got Linda Davis's group. They wanted to kind of get you involved in not putting people in jail or having you pick people up. That's good. That's rehabilitative. Are we finding these drug dealers? Are we finding the people who are the source? I mean, is there a Walter White out there?
It's tough.
Yeah.
Enforcement, again, we were heavy in enforcement, and we're still heavy in enforcement, though we do have those educational aspects too, getting the families and getting people aware of what's going on out there. But on the enforcement side, yeah, again, the drug dealers, they've caught on. They're trying to use new techniques and, again, abandoned houses and minimum supply on hand. So when you do go hit it, you're not getting so much. But, again, enforcement is still there. It's key that when we find these individuals that we're trying to find where it's coming from and try and cut it off.
Absolutely. Okay. I have no further questions. Thank you. Thank you, Madam Chair.
Yeah, this is for all the commissioners. I'm working with Crystal, and we're going to have a list of all the pay for the area for correctional officers and deputies, and it will show why Macomb County is not getting as many applicants as they used to, because the pay is not as good as it used to be, and the benefits aren't as good. So after she gets done with that, I'll make sure every commissioner gets that, and then we can bring back the sheriff or one of his captains to discuss that, and then with the HR department too. Okay? Thank you.
I don't have any other speakers on the list. Are there? Oh, there. Okay. Commissioner Kleinfeld, it just popped up.
Thank you. I just want to make sure that the newer commissioners got a copy of that study, because if we're going to be addressing it in May, it's pretty lengthy and they may need to get it ahead of time, and I don't know if all the commissioners got that or not. So I just wanted to put
You should have it in electronic format. If not, please contact my office. We'll make sure
We do.
that they get that.
Thank you.
Perfect.
Commissioner Brown.
Thank you, Madam Chairwoman. Thank you, Sheriff, for coming in. Following up on what Commissioner Leonetti was getting at about the enforcement side of the drug epidemic we're in. Of course, there's many things to enforce. There's so many variety of crimes you have to get involved with. What is the state of the overall county law enforcement agencies as a whole unit? Because you're one piece of you're the county branch, but certainly there's many departments underneath you, and working together, there are probably some units that are stronger than others because we went through that recession a few years ago. Many communities are still suffering the effects of limited tax base to provide the law enforcement they need for their communities. And there's a lot of crime in communities, and they may not have the resource to address that. Can you speak and can you characterize, are we 80% of what we need? Are we 50% of what the county really needs to really beat back the drug epidemic? Because it really seems, we're trying to battle against the waterfall of drugs flowing into our county and then affecting every part of our society and all economic classes.
Sure. From the enforcement aspect, I would say 15, 20 years ago, the big drug teams were the concept teams. Again, Comet, everybody sitting here, community at one point or the other, had an officer assigned to Comet to handle the issue countywide. And obviously with forfeitures and funding and things like that, most of the communities started their own drug teams and are doing it on their own. Though the networking in the drug enforcement community, my team can work with the Sterling team, can work with the Warren team. Again, I have the deputy still assigned to Comet, which is a state police task force. Again, there's a lot of work to go around, and, some of these investigations are lengthy at times. They're always following up on tips that are coming in with, mostly they're anonymous. They think that maybe their neighbors, selling drugs, a lot of traffic. So it takes time to develop that. But again, sometimes, we're working these individuals that are getting arrested with small amounts, and, you have to try and churn them and see where they're getting it. And again, the supply is out there, and the dealers are getting a little smarter, but the enforcement is there. I think we're in the 70s to 80% on the enforcement aspect of it,
Okay. What about communication amongst these various groups that are doing their own units? Each community's got their own drug. Are they communicating with each other to
They're
maybe pass along
talking,
information? I mean, that's always it.
most of the units, and I sit on the executive board of HIDA. It's high intensity drug trafficking. It's a federal program that gets roughly just over $3 million that goes out to the concept task forces. It's split up by a funding mechanism and a kind of a grant, and that HIDA does what's called deconfliction. So if I'm going to run, let's say, Don Brown, I could put your name and information through the HIDA deconfliction, and I'll find out if possibly Warren's got a case going with you, or Taylor, if all of those units are deconflicting. Because what we want to make sure is that we don't have what's called blue on blue type situations. If somebody's doing, if another community is going to do a drug deal with you and we decide to get involved, that you have two police officers that don't know they're police officers. So there's a lot of communication. I mean, there's communication on a local level. The teams work together. And if they use that deconfliction, if it comes up where, the sheriff's office has got a case open, that detective or investigator can call over and they can talk about it.
So in your opinion, it's working well then? That seems to be something that's working very well then? And
It's definitely something that needs to be there.
Sure.
For officer safety.
I drove did a ride along one night with one of your deputies out in the north end, and I sought to see that bit of technology to explain the process. That's exactly what he did. They'll file on a case that actually started and ended the night that we finished, because he used some of that working with other departments. It was really interesting to see how quickly he was able to get that information and help and resolve the issue that people were having. And so he probably does a good job. I've had huge comment in our communities, and our communities that come up and said, we got a system here, turn it over to the sheriff, and 6 months later, maybe 8, problem's gone. So thank you for what you do and all your men and women there. So thank you, Sheriff.
I will pass that along.
Chair Smith?
On one?
No.
Thank you, Madam Chair. I had one more question, Sheriff, in regard to covering for New Baltimore's court officer. When we have to do that, I'm just trying to figure out who, is that do they pay us then, or do they send us something? Or
Comes out of my personnel or my budget. So
It does?
Yeah. I think he maybe gets 3 weeks off, 3-4 weeks. I don't know what his time period is, but if he's gone for a week, then we'll assign a deputy there for that week.
Okay. Just seems, seems to me like if we're providing a service, we should be getting paid for it. So I'd like to at least, talk to you about that at some point.
Sure. It's a county court. Just send me the money.
Yeah, well, there you go. I guess we're getting paid out of the same. What am I thinking?
Yeah, there you go.
Sorry about that. No, you're not getting paid for anything.
Sorry about that, but yeah, that's a county court.
Just
So
dawned on
if
me.
you guys want to reimburse me, that's fine.
Yeah, all right.
Next question.
Nonetheless, it's part of your budget. Just so you know, and I know you asked about this, Veronica and Kathy mentioned, but the jail study is on our board sync, and it was sent out to everyone electronically, so everybody should have that or has access to it. And Commissioner Carabelli, I imagine you were asking about the food service because of the centralized food thing that we're kind of looking. Okay, good.
Yeah.
All right, I was going to ask about that too, but thanks. Thank you. I'm done.
Thank you. Sheriff, I have one question about the medical team that you have. A couple of months ago, you were in the news a lot. And to the extent that you can talk about that situation, Commissioner Kleinfeld and I received a couple of phone calls from people in our area with complaints about that. Are you able to talk about that at all, or is there pending litigation that we shouldn't?
Well, there's no pending litigation that I'm aware of. Obviously, there's medical information that we're not privy to under HIPAA.
Correct.
But I do know that when the woman was experiencing, she was brought down to the medical unit. She was inside the medical housing unit, and then she started to go into labor. They called the ambulance, and ambulance came, and the ambulance decided it's the best place to deliver the baby was there than putting her in an ambulance and transporting her.
Okay. So how does the medical team work? Do you have a doctor that stays in the jail, or do you?
Our contract calls for the doctor to be in there 40 hours a week.
Okay.
We have, per our contract, is on the day shift. We have 2 registered nurses that are there full-time and 3 licensed practical nurses. On the afternoon shift, would be 1 registered nurse and 3 LPNs that assess the inmates. They're on the phone with again, the doctor in certain situations, and again, we're sending a lot of prisoners to the hospital.
So are the nurses that are there, are those county employee nurses, or are those from?
They are Correct Care Solution employees.
Okay, so that they work inside of the jail?
Yep.
And under who supervises them? Do you supervise them, or does the agency?
They have a director of nursing. They have they're all supervised by Correct Care Solutions.
Okay, so then if a medical emergency comes up, then Correct Care Solutions makes the determination on how it's going to be handled, as opposed to the county sheriffs. Is that correct?
Yeah, they're the medical experts.
Okay.
My people inside the jail are the corrections deputies and the command officers. And again, somebody's experiencing problems, they contact the nursing staff. If not, if they can come on up to the floor or to the booking desk to assess, that's what's done. If not, we take them down to the medical unit. If it's an emergency type happens, they're up on the floor. We're on the phone with dispatch, just like any other citizen, getting an ambulance to transport them to the hospital. If it's not an emergency, then we'll have to pull a car off the road and take them to the hospital to be taken care of. And
Okay.
again, it's happening on a couple, 3 times a day.
Okay. And with regard to the opening of the UBHC, is the new 24-hour mental health facility on Garfield?
Okay.
Are you coordinating with community mental health? Are you taking patients there? Or is there a lot of interaction between your department and that new facility?
We were at the onset when they started. I think we were part of it, and we have an understanding of where it's at. Most of our individuals that we're taking, that if we find, and depending if they're suicidal, we're taking them and committing them, writing an EPE.
Okay, so you don't find that you are transporting individuals to that center?
No.
Okay. All right. Are there any other questions or any other speakers? Is there a motion to receive and file? Moved by Majek, supported by Romano. Please vote on your iPads. Thank you, Sheriff.
Thank you.